Welcome to Amazing Grays. This show is dedicated to the idea that active, informed older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
Hi, and welcome to another segment of Amazing Grays. I am so excited to introduce you to two fantastic people. On my left is the prettier one of the two, is Dr. Stephanie Coursen. And next to her is her husband, Dr. Curtis Bannister. Welcome to the Amazing Grays show.
Thank you, nice to be here.
Okay, now, what do you see as one of the most common spinal problems for people in their 40s like me, 50s like you, 60s and 70s?
Well, I think a lot of times a person will get injured in their younger days, and because they're young, relatively speaking, it'll heal up, it'll feel pretty good, but it's not quite right. A bone will be slightly misaligned for a long time, and what happens is an interesting phenomenon where it'll undergo degeneration. And what I mean by that is the bone above, the bone below, and then the subject bone, and we're talking about in your spine, of course, they become fixated, they don't move properly. And that area will undergo arthritis. And then later on, when in your 50s, 60s, 70s, 80s, you'll have arthritis in an area of your spine that's not equivalent as compared to the rest of the spine. So that area will be excessively arthritic, and people don't understand why. That's one thing that chiropractic does. We go in and make sure that those bones are not only straight, but the entire motor unit, again, the three bones, are all moving properly.
Is there a lot of pain with this?
When you, of course, needless to say, with arthritis, you're going to have pain. But again, in your younger days, when you get injured, let's say you have a little whiplash or a lifting injury, you may have pain immediately. But then as it heals, the pain diminishes or even disappears. So you could have a problem for years and years and years in your spine and not even be aware of it.
Dr. Coursen, are there any areas in chiropractic that you think are particularly important?
Yes, I do. Attached to the bones that Dr. Bannister was talking about are muscles. And when there's stress to these muscles, you develop trigger points. Trigger points are areas in the muscle, they're little spots. A lot of times people feel them up in their shoulders. They're spots where there is lactic acid buildup. When there's lactic acid buildup, the oxygen that flows in the blood cannot get to that muscle, and you start to develop a tightness in there. It doesn't just happen up here, it can happen in any muscle throughout the entire body, even the legs, the arms, the jaw. So what I do, I go in and I press on the trigger points to release the lactic acid and return the blood flow to the muscle. And when the blood flow comes back to the muscle, you get oxygen. And this helps to release the spasm and the tightness and helps to restore the proper alignment also.
So now, is that the treatment for trigger point therapy?
Yes, trigger point therapy, you just press on the muscle. When we're trained in trigger point therapy, we learn to find the trigger points, and we press on that and help to release the lactic acid.
So what causes trigger points? I mean, do we all have trigger points? I mean, what is this?
Yes, trigger points are caused by not only misalignments in the spine, but stress, tension can cause trigger points. Mm-hmm. And when their trigger points build up, it can also help to pull the bones out of misalignment, out of alignment, and then they need to be corrected through a chiropractic adjustment. Okay,
Dr. Bannister, where do you typically find these vertebrae that do not move properly?
Well, that's interesting because the spine, you would think that arthritis that we had just spoken about would occur evenly throughout the spine. It would be evenly distributed as we age, but that's not the case. We've got the atlas, the top bone, very susceptible to injury. We've got the lower neck, very susceptible to injury. And then there's a little spot in here between the lumbar curve and the thoracic curve, and then also, most importantly, the lower lumbar disc. Usually the L5, which is the very last disc. This is the one that a lot of people feel right at the belt line. Those are the most commonly injured areas of the spine.
Okay, what causes a hypomobile vertebrae? A vertebrae that actually doesn't move properly?
We had spoken about a vertebra that's misaligned. When that's misaligned for a long time, again, we talked about a motor unit, the bone above, the bone below, and then the subject bone. That will become fixated, not move properly. So the whole spine should move evenly, nice and smooth, like the parts of a symphony orchestra. Everything should work together. When you get an area that's injured and you get a stiffened area of the spine, and that goes on for years and years and years, let's say, that'll undergo degeneration and become hypomobile, won't move properly, and you get the stiffness that people associate with older age.
And what types of treatment has been developed to improve the spinal alignment or the mobility?
There's been a lot of advances in the last decade. We utilize a pure Stillwagon type adjustment, which is basically a very non-traumatic way to get adjusted. The old days where you get racked and cracked, that's not the case anymore. It's you can move the bone without hurting the person. We also use a Cox distraction, which is a way of decompressing the disc for, in particular, lower back injuries. But again, the treatments now are very gentle. And when people come in, let's say for an adjustment, it's a pleasant experience. They enjoy it.
Dr. Coursen.
Yes.
I understand, a little birdie told me that you're interested and you like treating pregnant women. Is that true?
I do. In the past few years, I've had a couple of my own children. And before I became pregnant, I did not realize the changes your body goes through and the stress to different parts of your spine and body. While I was pregnant, I had quite a severe increase in my pain due to the increasing size of my abdomen. So my husband here would give me treatments almost weekly, not always adjustments, but sometimes trigger point therapy, and when it needed to be adjusted, he would adjust it. So I thought we should get some equipment for pregnant patients, and we've gotten pillows to help the patient be able to lie face down, which is something a lot of my pregnant patients say, oh, I need these for at home because it's such a rare thing to be able to lie face down. So what we do is we have them lay down, and we usually do trigger point therapy first, and then we give them an adjustment, and a lot of my patients rely on this just to get through their pregnancies.
How long can you do therapy?
We can treat them throughout their entire pregnancy. A lot of times they're concerned about late stages of pregnancy, of whether or not it's harmful, but it's completely beneficial, not only to them, but to the delivery process. Research has shown that chiropractic care in conjunction with the pregnancy process helps to give better deliveries.
Right up until the day of delivery.
Right.
Oh, wow. This has really been fascinating. I'm just so excited that you were able to come on and really talk to our clients and our audience and let them know exactly what is available, and if they have those little funny aches and pains, that there's a place that they can go. They can go to a chiropractor and hopefully be all better, and especially as a pregnant woman.
Yes.
Again, I want to thank you both for coming, Dr. Bannister.
Great being here.
Dr. Coursen.
Let's do it again.
Thank you.
We will. All you got to do is just say when.
Okay. Thanks for having me.
And to you, your host has been Joe Johnson.
Thank you for watching Amazing Grace. We are an all-volunteer organisation and are always looking for people to help us produce interesting programmes.